Wow, what a day it was yesterday. Oh, it's pretty bright up here. I should have brought my sunglasses.
It is bright.
Mike, thanks for the kind introduction, and thanks to you and Ginger for your inspiring leadership. It's really an honor to be here with you today at the biggest and the best VLC ever. One thing Mark forgot to mention about the Texans, could you raise your hands? If you don't have your hand raised, look around. Keep your hands up. Look at those people. The point I want to make is that Texans love to party. So when you're on the dance floor, look out for those folks and see if you can hang out with them for a few minutes. I'm sure you'll have a great time. I have a memorable hangover from a party in Texas a while ago. So for my presentation this morning, I have two objectives. The first and most important objective is to tell you about the many ways that people with CF and their families are contributing to high-quality CF care, and perhaps even pique your interest in making a contribution. And the second objective is to convince you of the importance of real-world research. Now, this slide shows the topics that I plan to touch on. And I'm looking down and I can see Preston's face. He's a little concerned that I'm going to get pretty boring here. He's thinking I should have had another cup of coffee. But I promise not to get too deep in the weeds. What I really want to focus on is how people in the community are really powering us to move these initiatives forward and how we need you. So I'm going to showcase some examples here throughout the talk. So you've heard about the registry, and I believe it's one of the crown jewels of the CF community and the foundation. It dates back to the late 60s when I was in grade school, or maybe I wasn't even born then. I don't remember. You see that report to the left, 1969. One very important thing to start out with when I talk about the registry is it would not exist without people with CF and their families consenting to share their data. That's the most important thing. Without that, we couldn't do anything. And given the current environment with hackers prying into every database and sharing that data, we recognize that consenting to share your personal data is a precious gift. So thank you for your willingness to share your data. And I assure you, in collaboration with IT and compliance departments at the foundation, we take that responsibility of securing your data very seriously. Now, I want to tell you just a few things about the ways that we use the registry data. I think it adds value to the community in so many different ways, starting with this annual report that you see on the screen. This is on our website. If you go and look under research, there's a patient registry tab. Click on that and you can get to this report. It's about 80 pages long, very granular data that gives you all the progress that we're making on the disease. Now, this is the importance, and Mike Boyle and Preston alluded to this yesterday, the importance of what Mike called clinical care research and I call real-world research, real world of clinical practice. And what this means is that we want to learn from every encounter, every clinical encounter, every exacerbation. You've heard the example that Mike shared yesterday about exacerbations, and I'll talk just a minute about that STOP2 trial. There were about 20,000 pulmonary exacerbations requiring treatment with IVs in 2015. 20,000. Each treated for approximately 15 days. That's about 300,000 days of IVs among all patients across the country in that particular year. Imagine if the STOP2 study showed that 10 days of IVs is good enough. That could save up to 100,000 days of IVs. Now, our aspirational goal is no exacerbations requiring IV antibiotics. But until we get there, saving 100,000 days is a reasonable start. Another example of real-world research I'm gonna move on to now. And that's new therapies. We've heard a lot about drugs coming through the pipeline and some of the great drugs that have been approved. A lot of these drugs in an orphan disease like cystic fibrosis, there's not much human exposure to the drugs. So the safety profile is inadequate at this stage of clinical trials. This is where real-world registry-based research comes into play. We can really track and see if there's any 1 in 1,000 safety signals that's really important to be aware of. Also, this point about efficacy in clinical trials, it doesn't always translate into effectiveness in the clinical arena. So it's very important to use the registry data to see how does it play out in the real world. We know in the tightly controlled setting of a clinical trial, frequent visits, adherence is probably better, not so much so in clinical practice. So we need to follow through. And the FDA often mandates these sorts of studies. And we use the registry to collaborate with companies to do these studies. And I'll show you just one example of a study of one of the transformational drugs that we've talked a lot about, ivacaftor or Kalydeco. This shows, remember the drug was approved early in 2012, so this is 3 years of data, and this work is being prepared for publication now. And I'll show only one slide, and that's the impact. This is comparing ivacaftor-treated patients in the registry in clinical practice to a registry comparator group. And you can see this drug is reducing mortality, reducing need for transplant. So this data is confirming this really works, and there's no safety signal that showed up. This drug really works in the real world. This is what we want to see. This type of study will be increasingly important to demonstrate safety and effectiveness as additional CFTR modulators come on the market and other therapies as well as they move into the clinic. A little bit more about the registry. Many of you probably know that we've had a registry committee in place for a number of years, and it's comprised of physician scientists, epidemiologists, biostatisticians, nerds like me, that love data and love to mine the data. And they've helped us identify priority research areas, and much of their work has been published in the peer-reviewed literature. But it occurred to us that we should also tap into the perspective and expertise of those living with the disease on a daily basis. So we formed this Patient and Family Advisory Committee, an amazing group of individuals shown here. You can see their pictures, and I think 2 or 3 people may be here, and hopefully others online. Can you raise your hand? I think Breck may be here.
Camilla's here.
David is here. Camilla. And hopefully the others are online. So these are parents. They're adults with CF, or they have some other personal and close tie to cystic fibrosis. And of course, they have that wisdom and experience of living with the disease on a daily basis. Some of these folks had a strong scientific background, and others were eager to learn. So the first thing we did was to educate them about observational data, its nuances and its biases, to bring them up to speed. And then we set out about launching Insight CF. Has anybody heard about Insight CF? A few hands. This is really to engage the CF community, the entire CF community, in registry-based research. And this is the way that we're going about it, these 4 steps. Asking the right questions, prioritizing research topics, participating in the conduct of research, merging that PFRAC, that Patient Family Advisory Committee, with our registry committee to actually conduct some of the research, and then disseminate the findings, publish and disseminate the findings. We're at about bullet point 2 right now, and I'll share another slide with you in just a minute. But I want you to be aware that you can find more information about Insight CF on our website, cff.org/InsightCF. So Insight CF was launched at the plenary session at the last North American CF conference. If you haven't heard that plenary, Wayne Morgan delivered it. He did an outstanding job. We've used all of our communication channels to get out to the CF community, and we invited people to submit research questions from the plenary through the end of January. And I'm pleased to announce we received 440 submissions. And and working internally and with the PFRAC, we're starting to divide those questions up. Some are potentially answerable with the registry data, some not answerable with the registry data, and some not really research questions, but asking about educational resources and other questions like that. So now we're eager to move this forward, and stay tuned. Mike, I think, mentioned clinical practice guidelines, and these are really important for CF care in the U.S. and throughout the world. They provide a framework for the clinicians to refer back to, and we take this responsibility very seriously. We use state-of-the-art approaches, and we hold ourselves to the standard of publishing in peer-reviewed literature. Now, we bring multidisciplinary teams together, but we always include an adult with CF and parents of children with CF. Has anybody in the room participated on one of our guidelines committees? I see one hand. And also in our guidelines steering committee. This is the group that decides what guidelines we're going to go after next. So they bring a really important perspective to the guidelines work. I'm going to share just one anecdote, and this is the work that we did in collaboration with our European colleagues to develop guidelines, mental health guidelines. And you can see this multidisciplinary group right there in the middle. I don't know if you know Kim Reno. You need sunglasses around her smile. She's an amazing smile. But the person that I really want to point out is Chris. He's an adult with CF, and he's a prosecutor in Rochester, New York. So behave yourself if you're in Rochester. You don't want to meet Chris. This is, and I know you can't read this, so I'll just read a paragraph from his comments that were published in our network news. He said, "The writing of the guidelines was left to the professionals, but it was a collaborative process, and when I read them, I saw my fingerprints. I viewed my role on the committee as using my personal story to elevate the profile of mental health issues, generate buy-in from the clinicians, and illustrate the need for resources from the foundation to enact the guidelines and enable clinicians to provide the best possible care for all people with CF. These issues cannot be ignored, and I'm incredibly proud and humbled to have had a chance to contribute." Of course, we didn't let Chris go. We asked him to serve on our advisory committee focused on implementation of the guidelines, and he continues to make a great contribution to this work. This was the reason I joined the foundation, to sort of help lead the quality improvement initiative, and we've had some success. We've published this work in the BMJ Quality and Safety Journal. This is all open access. Feel free to Google BMJ Quality and Safety supplements, and you'll find the supplement. It tells the CF story, at least on the improvement side of things and on the care side of things. But what I want to call attention to you is, in collaboration with our colleagues at Dartmouth, we developed a strategic plan for quality improvement, and we called it our opportunity statement. And this was the vision: exemplary care at all CF care centers. And one of the first of 7 worthy goals, I'll let you just read that. It talks about partnership. So that's the goal that we're working towards, partnership. The other thing about quality improvement, and don't tell Preston this, he thinks I lead the quality improvement initiative. It's actually Kathy Sabadosa, parent of a child with CF. Jack, he's getting ready to go off to college. Incredible young man. And Kathy is an incredible woman. What about the experience of care? One of the things that we've learned is the registry is great, but it doesn't have all the important metrics that we need. So we looked at this experience of care surveys that were out there. We realized it didn't hit on all the topics that we needed to assess, including infection control. So we worked with our Dartmouth colleagues. We conducted focus groups with clinicians, with adults with CF, parents of children with CF. And guess what their number one safety concern was? Infection control. So we developed a domain to get at infection control. We can't really get at that in the registry. So we think this is going to be a driver of improvement in infection control practices. So at this point, it complements the registry data, and we're starting to get some traction with this now. About half the programs across the country are participating. And I'll just share a few nuggets from what we've learned so far. And you may not be able to read this. This is the good news. CF care teams are really highly regarded across the U.S. You may not be able to read this, but it's getting at, did the healthcare teams treat you with courtesy and respect, explain things in a way easy to understand, spend enough time with you? And these uniformly rate at the top box, yes, definitely in the 90% and above range. So that's the great news, and we expected that. And there's some individual comments here. I'll just read this one. My care is totally individualized, and I'm made part of all the decisions. Even though the team is large, I always feel that each person is knowledgeable about my body and my outcome. I'm going to skip this because I see my time is running short. I'm going to mention one other thing about infection control and the experience of care survey. What we're seeing is improvement over time. This is one question that's lagging a little bit behind, and it's were you brought to the exam room as soon as you arrived for your appointment. And we're seeing improvement where we're pushing hard on this as well, because some of the comments that are entered suggest there's concern about this. Here's one. The wait times in the waiting room before you're seen by the doctor need to be cut down so the CF patients are not near each other. So we get these sorts of comments back. We feed this data back to the care centers, and they use it to improve. I'm going to skip these comments in the interest of time. So with the experience of care survey, we want you. We want your input. If you receive an invitation, please complete the survey. If you've never received an invitation, please ask your care center to participate. We need that data. Okay, I've talked about the registry, guidelines, quality improvement, experience of care. Over the next few minutes, I'm going to talk about what we refer to as the care model of the future, the co-production dashboard, the pilot learning network, and partnerships for sustaining daily care. This is one of my favorite pictures about the co-production dashboard. I think this girl is about 9 or 10 years old. She's got her Fitbit on her wrist. And look at her studying that graph. A true nerd in the making here. I mean, she's like amazing. So this is about designing and testing new ways to partner. It was designed at 5 programs across the U.S., Minnesota and Chicago, designed with people with CF, families, care center teams to improve the way of working together. And we're in user acceptance testing now. It's been named by that community, that pilot community, CF Health Check, and it's in a testing phase right now. So stay tuned. It's mobile ready. It's a way that we can collect patient-reported outcomes like health-related quality of life. What do I want to discuss at my next visit to get at pre-visit planning? So we're very excited about this. And that work, by the way, is done in collaboration with colleagues at Dartmouth. The CF Pilot Learning Network is done in collaboration with our colleagues at Cincinnati Children's. And the aims are to establish an infrastructure for collaborative learning and demonstrated progress across the network towards improved outcomes. And I won't go into those outcomes. You know the pulmonary outcomes, you know the nutritional outcomes, but there's also patient-reported outcomes as well, health-related quality of life. We can't forget those outcomes. And we're going to set and try to achieve those aspirational goals that we set. Various design features for the Pilot Learning Network. I won't go into these in detail. I'll just mention that this is really helping us get more timely data entry and get more frequent reports back to the care centers. We think this is really going to accelerate the improvement work. The connectivity piece, there's community conferences where this group of 13 programs come together, and there's a technology platform that I'll mention, the CF Exchange. And we're trying to engage patients and families in the quality improvement work to the extent that it's not just contributing the voice of the parent or the voice of the patient, but they're co-creating or co-leading the initiatives. This is that technology platform that I mentioned. It's called the CF Learning Exchange. It's password protected. It's a Pinterest type format. You can create and post an original pin. You can browse for a pin. You can join a discussion group, and there's a search feature as well. Clinicians, people with CF and their families are on this exchange, sharing ideas and stealing ideas from one another. There's a group called the Community Innovators, and I think there may be some members of this group in the audience. I think I saw Pam, and there may be others. Their goal is to grow the number of people and families with CF equipped with the skills needed to create and sustain strong partnerships with the care teams around mutual trust, collaboration, and empathy. So this partnership theme comes back. We had our community conference just about a month ago, and it was a great conference. One of the things that was most memorable were talks like we heard here. They were called Ignite Talks. They were from individuals with CF, parents of children with CF, and clinicians. And these were really inspiring. And here are some of the folks that participated, some by Blue Jeans. Aaron Moore is there, Dan, David, Greg, an adult with CF and his 2 children. He's in his mid to late 30s. He was there in person, shared a very powerful story. And this is a comment from Lisa, who works with the Seattle pediatric team. What I deeply appreciate about this initiative is the recognition that it takes all of us, parents, patients, medical providers, and the CF Foundation to work together to defeat this disease. There's so much talent within the parent and patient community, valuable skills and gifts that don't necessarily fit easily into the medical world. I'm so grateful to the Foundation for welcoming ideas and contributions from parents and patients. Thank you. And then finally, I'll briefly mention an initiative that Cindy George is leading, Partnerships for Sustaining Daily Care. And the most important part of this initiative is on this title slide. We moved it from a top-down adherence initiative to a patient engagement initiative until patients and parents says, well, what about the care teams? Shouldn't they be engaged as well? And where we landed was Partnerships for Sustaining Daily Care. And this effort was co-led by an adult with CF, Marissa, and Cindy George, and we're making significant progress. And it's a multi-pronged approach, and I don't have time to go into details other than to say that Cindy has brought us back to the importance of relationships. And open and honest, non-judgmental conversations are a great starting point when you're talking about the daily regimen, and to get at a regimen that really is sustainable over time. So I've touched on all these various initiatives, and so I'll close that indeed the work on high-quality specialized care is driven, inspired, motivated, and powered by the CF community, all of us together in partnership. So thank you. Next up is my esteemed colleague and friend, Mary Dwight.
Thank you, Bruce. So as Mike said, I get the privilege and the pleasure of overseeing the Foundation's policy and work, as well as work on coverage and access. I'm going to focus today's talk on access and coverage, but I don't want it to go unsaid that there's a lot of policy work as well to support the amazing scientific progress you heard about yesterday. So I'm just going to give a 12-second plug to let you know that the NIH and the FDA remain critical partners and vitally important to our work. My aha moment yesterday that I'm going to spread all over Capitol Hill is the zebrafish. How cool is that? And that is really the bedrock of so much of work that emerges there. So I'm not going to talk about that other than to say, don't you worry. It is still vitally important, and our eyes are laser focused on those programs. Okay, we've been a little busy in access and coverage land this year. I'm going to talk to you about 3 things this morning. Not surprisingly, we're going to spend a little time talking about the healthcare coverage debate going on. I know probably everyone in this room is paying close attention to that, so I'll do my best to give you a landscape on where we are on that. We also want to make sure that we talk about the other things that the foundation does in this space, and vitally important, as Bruce just said, is all of you, making sure that our voice is heard and it's very clear to the people making coverage decisions what is necessary for high quality, good cystic fibrosis care. So we're going to talk a little bit about that. And then I'm really excited to talk to you a little bit about Compass. There's a breakout session this afternoon. There are actually 2. So if there are a couple things that you want to go to, you can make sure to hear about Compass. It is an unbelievable service with amazing people who work every day on behalf of you and with you in collaboration. So I'm excited to share a little bit about that. Okay, let's dive in. So there's a little discussion on healthcare these days. How do we engage? Why do we matter in here? Well, obviously, the need for high quality, specialized cystic fibrosis care, the kind of care that Bruce just talked about, the kind of care that delivers on the amazing progress that we continue to make, that you heard about from Preston, Mike, and Bill yesterday, is what matters, right? And we as a CF community look different than the general population in this debate, and we have very unique needs that must be met. And that is what guides our work in healthcare coverage debate. So as you know, November said healthcare was going to be at the forefront of the discussion. The election meant we were going to have a debate about this, and whoa, have we been having a debate about this. Our goal in all of this, I'm going to borrow from my fearless advocacy co-chair, Rebecca Schroeder, it is not political. It is personal. And our job as a collective community is to tell that personal story, that story that we've all been talking about of why cystic fibrosis care is unique, what components make it up, and why it matters. And dang it, we're going to hold their feet to the fire to make sure that they deliver on that in whatever emerges from the debate. Fundamentally, what do we stand for? We promote policies that ensure that everyone with cystic fibrosis, everyone, that is underlined for a reason, leave no one behind. The same thing that we feel about with the pipeline and drug discovery until we have something for everyone applies to coverage. Everyone matters. And everyone gets their coverage in a little bit different way. And that is a big part of what our discussion is. Everyone in our community has access to that high quality, specialized care that you get at a care center, the prescriptions and the therapies that they provide, and that happens in a way that's affordable and regardless of your income, your employment status, your health status, or where you live. So that's what guides us. I want to dive into that just a little bit more because I know we get a lot of questions as we, especially on social media, where we have to sort of be quick and brief, where we say, you know, we are taking a stand. In fact, in case you didn't know, we opposed the bill that happened, that did not get a vote on a couple weeks ago. And we opposed it for these basic 3 reasons. Because it failed the cystic fibrosis community, because it failed to provide adequate coverage, it failed to provide insurance that would guarantee somebody that their therapies and the care delivered at a care center would be covered. It failed to meet the affordability test, It was going to set up a situation where the health insurance plan that provided that adequate care, that provided that care at a care center, provided those high-cost specialized medicines would be affordable to somebody. And it failed the availability test. We need to make sure that no matter where you live, no matter how you get your insurance, that you are able to get a plan that works for you and provides the care that you need for your cystic fibrosis care. So those are the principles that guide us, and that my amazing team spends a lot of time combing through the lines of the legislation to say, how is this going to stand up to these three pillars? Adequate, affordable, available. That is the lens that we're going to look through everything, and that's going to guide us in analyzing and taking positions on whatever is coming down the pike. There are some components in here that we dive deep into. Frankly, this is just the tip of the iceberg because I only had 15 minutes. I can go on, and I don't know that you really want to hear me go on and on about it, but you can come to the breakout session and hear a little bit more if you want. But some core components I want to just make sure that everyone understands, because again, these sort of break down from those three core pillars of affordable, adequate, and available that I just walked through. Some things we're really watching. Not surprisingly, and fundamentally, those protections for people with pre-existing conditions that emerged as a result of the Affordable Care Act when it was passed 7 years ago. I want to take a minute to make sure you understand what that really means, because there's a lot of rhetoric. Not surprisingly, out of Washington, there's rhetoric. There's a lot of rhetoric. Oh, yeah, pre-existing conditions. We want to protect that. That's fine. Unfortunately, as with anything, rhetoric doesn't legislate. Rhetoric doesn't execute good policy. And the devil is in the details. So what are the details that we're watching for particularly? The protections that we believe make meaningful protections for somebody with a pre-existing condition are three prongs. One, a health insurer must sell you a plan if you have a pre-existing condition. They cannot say, I'm sorry, you have cystic fibrosis. I'm sorry, you have diabetes. I'm sorry, you have multiple sclerosis. We're not going to sell you a plan. They must sell you a plan. Importantly, that plan must cover the care that you need for that pre-existing condition. So if I had breast cancer and I purchased a plan, but it excluded my chemotherapy for the breast cancer, not so good for me, right? So I have to be able to purchase a plan, and it has to provide the care that I need for that pre-existing condition. And then critically important, one that keeps slipping off the table, is they cannot charge you more, right? They cannot charge you more if you have a pre-existing condition for the plan that you need. And that's one that I think is really slipping. And that's one where we're really going to keep holding their feet to the fire as they kind of slice and dice things into part. They're eviscerating a lot of those core protections in the way that they're getting about some of these solutions that keep coming up. They cannot charge you more if you have a pre-existing condition, because if they do, then the wall crumbles underneath us, right? So we're going to hold their feet to the fire on that. I want to take a moment also to talk about Medicaid. Remember, I underlined everyone. I want to give you some stats. 55% of all children with cystic fibrosis get their care in some way through Medicaid. 55%. And over a third of all of our adults with cystic fibrosis get their care in some way through Medicaid. So Medicaid matters, and we will fall on our sword for Medicaid. It is vitally important to this community. It is a critical safety net, and we are watching it closely to make sure it is as robust as it needs to be, to make sure that Medicaid provides the same quality, high quality, specialized care for people with CF, because too many people in our community rely on it. Okay. High-risk pools. This was the gossip of the week. For those of you paying way too much attention to it like me. High-risk pools are an idea that's been floating around. We are watching these ideas really carefully because they really didn't work the last time we tried them before the Affordable Care Act. The idea of siloing off people with really high costs, guess what, people with CF, is complicated. And we are going to watch those real carefully. And I don't need to tell anyone who's in this room or who's watching online about annual and lifetime limits in cystic fibrosis. I know many of you listening, I know many of you in this room have personal stories where you can add up to those caps that existed beforehand damn fast. So those are vital, important, and we're going to make sure they stay in as well. There's a whole lot more on that, but in the interest of time, we're going to keep moving. What are we doing? Well, first of all, you all have been unbelievable. I want everyone in this room and everyone online to give a giant, huge, happy dance for the amazing power of this community. My God, have you all blown us away. And I'm going to take a note from Mike Beatty. Thank you, and you're not done, okay? There are three components that we basically break down our work that we started the day after the election when we knew healthcare was coming. We break our work into analysis, and I kind of just went through some of the core prongs that make up that. External partnerships, which I want to touch on, and community outreach. I just can't say it enough. Thank you, thank you, thank you. My God, this community blows me away every time. I've never been more blown away than I have of the power of your voice, the volume of your activation. You've got to keep it up. I know you will, and we're going to talk about that just for a minute. It's been amazing to watch. I'm really proud of the leadership of the CF Foundation and external partnerships. We are a little disease, and we are not going to win this debate alone. But the good news is we are not alone. And there are millions and millions of people who are along the ride for us with us. They need it too. This healthcare matters to so many people. But one thing I'm really proud of our work is that the foundation, because of the work all of you all have done for a decade on Capitol Hill, is seen as a leader. And we have been leading with some of the big guns that Amy mentioned, American Heart, American Cancer. There are partners, and we are seen as their peer in terms of our sophisticated, amazing advocates who storm the castle every day for what we need. These are just a few highlights of what that partnership has looked like. Right away in December, we sent a letter to then President-elect saying what matters in healthcare, what the baseline principles we will be watching and want to work on together were. We led that letter. 73 other patient advocates from small to huge joined us in that. And that's the power of you all as leaders, as the best story in medicine. 10 other patient advocacy organizations, some of the largest patient advocacy organizations by numbers of patients, joined us in outlining core principles that looked like those three that I outlined, and we are all working very closely. We have, I don't even want to know how many emails, pretty much daily, together to share the power of the patient voice together in Washington. And again, we led the way, spearheading just 2 weeks ago in the throes of the debate as it really reached culmination. 86 organizations, we wrote them to say Medicaid matters, and we would be watching it closely, and we're not letting them off the hook about this. So yet again, the CF Foundation is leading the way, and it is because of all of you and the power of your voice that we are able to do that. So I'm really proud of this, and thank you very much. You all, I've gotten a lot of questions, and Amy stole my thunder of asking how many people had participated, and it's just amazing to see so many folks who have gone countless times and have real, true relationships with your elected officials. Your voices matter. You all have been amazing in telling that story in your communities and trying to figure out ways to inject why health insurance matters, why your coverage matters across all different angles of the debate. A key strategy has been media outreach. It is driven by you all. For those of you, I think several of you are in the room. If you've had an op-ed published, can you stand up? Ginger? Rebecca? Do we have JJ? Anyone else? This is a drumbeat. You guys have been amazing. I just read these quotes here. A drumbeat, I will say, all of these papers are in battleground states for us, states where we think that we can make an impact on change a vote. So they're important politically, but mostly they're important because this is why we're doing this. So I just love this. You guys are driving this. Keep at it. Tell the story. That's what it's about. These numbers speak for themselves. I mean, my God, I'm just blown away at the volume of storytelling you have generated. When we say jump, you guys don't say how high. You have like leapt over the high bar. 34,000 messages from 8,500 people in the community in this year alone. That is amazing. Amazing. And it's not just federal. I mean, obviously I'm sitting here speaking a lot about the national debate. We have fights in the states as well. And a few weeks ago, we have a big fight in Ohio, and I think we're winning, knock wood. We asked the community to take action. In 48 hours after we sent an email saying, please write your state legislator, we had sent 6,000 emails. 48 hours, 6,000 emails in Ohio. You better believe that matters. I want to tell you that it matters because we hear it repeated. We hear it repeated on the floor of the United States Senate. We hear these stories read on the floor of the United States House. We see members tweeting your stories. We see them quoting you in papers. Your story matters. And it is what's going to win the day in this debate. Preston actually got a call from a United States Senator saying, thank you. Thank you for giving us these stories. But what else she said was, keep it up. We keep needing them. And I know so many of you have amazing ways to get those stories out. I'm going to shout out, can the Sparrows stand up? Frank and Dee. So Mark talked yesterday about not getting in the way of a CF grandma, and woo, I'm with him on that. I'm gonna extend that to don't get in the way of a CF grandpa, and don't get away in the way of a great uncle or a great aunt, because they are forces to be reckoned with. And Frank told me he has a big old tree that he gets started when we send an email saying, take action. Frank, it's time, make those phone calls. He's calling frat brothers. He's calling his buddy from basic training at the Army. He's got former colleagues. He's got like the bus driver. Everybody gets a call from Frank saying, are you making those phone calls? And that's what we're going to have to do. We're going to have to flood the gates here. And so that's a great example of what we need to be doing. And thank you. Thank you. Thank you. Keep it up. You're not done. I also want to spend just 30 seconds talking about the other amazing work that our policy team does. This is Bruce and I have an ongoing debate about which one of us works for each other. I work for Bruce, and our job is to make sure that all the amazing things that Bruce just talked to you about that happen in the care centers can happen unfettered, and that payers pay for them. Okay? And we spend an awful lot of time engaging one-on-one with payers across the country, state Medicaids, private payers like Blue Cross, Blue Shield, Aetna, United. We have conversations with them, and the bedrock of those conversations is what Bruce went through. And the bedrock of that is your voice, your data. The payers take us seriously when we walk in the door with things like the patient registry, with things like evidence-based guidelines that are really the crown, another crown jewel of the Cystic Fibrosis Foundation story. The fact that we can come and tell a natural history and a proof is in the pudding and use that real world evidence that Bruce just outlined for you to say, this is why you need to pay for this therapy. This is why that policy that you put forward is not sufficient and not providing the high quality specialized care that we need. It is a collaboration, and it is driven by the data that this community provides. It's vitally important. It's almost always behind the scenes, but I want to make sure you know that it's happening. This is where it's happening everywhere. I'm not going to take time to go into what this slide means. It's busy because we're busy. It's busy because there's a lot of engagement that has to happen with payers to make sure they understand the unique needs of cystic fibrosis and they understand the data that we can bring. And I'm really proud to say that a lot of times, not every time, but a lot of times, we have wins here and we can make changes collectively in the way cystic fibrosis is covered to improve the coverage that's provided and reduce some of those barriers. But when we can't, this is something that I'm so very proud of. Compass is here to help. How many of you has anyone ever called Compass or know somebody who has? It's amazing. Great. So again, we have a breakout this afternoon where you can learn an awful lot more about the amazing work that Compass does. I'm running out of time, so basically, I'm actually out of time. But basically, Compass is a team of advocates who help you navigate the complexities of insurance, financial issues, legal issues, and other complex issues. The type of detail that they go into just is amazing. These are long relationships that people have with this team. And here are some highlights. The one I really want to point to is the bottom one. That's the place of biggest growth of calls to Compass. 2,000 requests were for help with some other aspect of living with cystic fibrosis. So Mark told the story that he remembered in Utah yesterday about the family that was experiencing food insecurity, the family that didn't know where food was going to come from. That's the kind of thing that we're seeing an immense amount of growth happening in calls to Compass and the type of thing that we want to be able to help our community with. There's some amazing stories, and one that stands out to me is last summer in California, where there were all those wildfires and immense drought in California. There was a family with a child with cystic fibrosis that lived in a rural area, and their well ran dry. And they obviously needed water to be able to clean their equipment and just general. Compass helped find them water. Compass worked with a local community organization to bring in a big truck. I'm looking at Ozzy. It was like 800 gallons of water, and then arranged for a new well to pay for a new well to be dug. That wasn't foundation dollars. That was making network connections to find somebody who could help this family so that they could have water. How amazing is that? And that's the kind of thing that we can do. So I want to leave you with just a little snapshot of the kind of work we do. And I'm looking, Chris, do you want me to hit forward on this slide? Yes? Okay.
This is Bruce. This is Heather. This is Aaron. How can I help you?
Hi, Aaron. I just had a question. ¿Habla español?
Sí, hablo de español.
Hi, I was calling on behalf of a CF patient. I am her significant other, and I help take care of her, and had questions about dental work.
Our insurance required that we switch specialty pharmacies.
I hope you can help us.
I'm not able to get my enzyme replacement medication covered by insurance.
Sure, I'll be glad to help you.
So I wanted to call, introduce myself, maybe get a little more information as to what I could potentially help with, and then talk about next steps.
I'm so sorry.
Oh yeah, no problem. I know this can be a bit confusing, and I know you're trying to help, so we'll just do it together.
Tell her to call us, because this is exactly what we do.
Yeah, because I've worked in healthcare as retired and know how complicated it can be for patients. But in my situation, it's just seeing how the doctors, a nurse, and the Compass, and myself, we all worked together to make something happen that was positive. Thank you so much. You're just like my little guardian angel that I know will just show up when I need you.
Thank you, sir. God bless.
You're very welcome. Talk to you soon.
Thank you so much. I can't tell you how much I appreciate this. You have a great day. Thank you so much, honey. Bye-bye.
Well, you've heard a lot about how this incredible community uses its talents to help many of the things that go on here at the CF Foundation. But our department is new, and so I'm going to tell you a little bit about community partnerships and how we came to be. But what I really want to say is this is not a silo. You can see how this work is all throughout the foundation. So I work with Mary, with Bruce, with Mike, with Gina, with Maureen, all across the foundation. But we are a new department, and our job, as you've heard here, is harnessing the power of this community. So here's our mission. You've seen the mission statement before, and we want to provide all people with the disease to lead, have the opportunity to lead full and productive lives while we are looking for the cure. It's not an either or, it's an and. And so in order to have the largest impact on our evolving community, we began the department called Community Partnerships. So these are our goals: to bring the perspectives of a wide range of people with CF, and those who are affected by CF, into all of the activities at the foundation, and you've heard some wonderful examples this morning, and to provide for ways for people who are living with the disease to interact with each other and with the foundation in meaningful ways. We want to bring the wisdom, I love the quote also from Lisa of the talents, of the people who are in this community into everything that we do. And I love this quote: knowledge comes from learning, but wisdom comes from living. And so living with CF day after day after day after day after day after day is something, those experiences are not things that those of us who don't have CF and don't have a family with CF, a family member with CF, can really know in that deep way. That wisdom is something we want to bring into all of the things that we do. So I'm going to tell you about 2 programs that are ideas that have come from the community, and then I want to tell you about a new initiative, an announcement today. You've heard a little bit about this word, community voice, but today is the official beginning. So I want to thank any members of the Adult Advisory Committee who are streaming online and who helped bring some of these ideas about online events and peer-to-peer mentoring to us to say, we want this to happen, and our job of community partnerships is to enable those ideas to become real. So I want to start out by talking about BreatheCon. This was an idea that came from the community, saying we want to be able to connect. We want a convention where we come together to share our experiences. So adults said we'd like a virtual conference, something online where we can be with each other and share our wisdom and our talents and our thoughts. And so our group brought together some software. It was a piece of software that was really used for the sales community for virtual sales conferences, and also some online video conferencing. And that sounds really easy. I'm telling you, it was like a giant effort. But we did not control the content of this, we the foundation. The entire content of this event was designed by adults with CF for adults with CF. One of the first things they said was the software sort of looked like a convention center. It was for salespeople, and they said, we don't want to go to a convention center, we want to go to the beach. So we redesigned the software to look like this. So I'm going to give you a little heads up about what this beach environment looked like, and then I'm going to show you a video. So there was a lifeguard stand. That was where there was a welcoming video and some other information. There was a keynote hut. There were a couple of keynote speeches. A volleyball court for breakout groups, just as you all are going to have breakout groups. You had some yesterday and later on today. We had some live streaming mindfulness-based stress reduction and yoga. There was a bonfire where there were panel discussions. There's a pina colada station, and that was for connecting and chatting. And I will say at one point, all the software, the connectivity broke down, and what did everyone do? They went to the pina colada station and chatted with each other until we got things fixed. If you can see those little circles, there were seashells and starfish scattered along the beach, and if you clicked on them, again, this theme, the power of stories, there were stories underneath those shells and starfish. And then, of course, there was tech support, the life raft floating offshore. So with that, some of you have seen this video before, but for those of you in the room and those of you online who have not, I want to show you a 4-minute video about BreatheCon. So if...
It's not easy, it's painful, it's unfair, and it sucks, to say the least.
And we're desperate to feel like we can make a difference and not be thought of as the sick person still.
In the sun today at our first ever BreatheCon. Enjoy.
Welcome everyone. I'm Kristen Dunn and thanks for joining us.
It was very important to us to provide a safe space so that small groups of us could get together to talk about so many amazing topics.
And welcome. I'm super excited you're all here.
It's an absolute pleasure to be with you.
It's awesome to virtually hang out this Friday night.
Dreams get modified sometimes. It doesn't mean you don't have them, right? I never thought I'd get married. I got married. I never thought I'd be able to have kids. I have kids.
You stretch back, feeling the stretch across the front collarbone.
So I'm here to talk to you about mindfulness and about meditation.
Thank you so much for joining us. Thank you so much for the amazing questions.
From the CF Foundation, we will be able to do more events like this.
So many people said, well, why didn't I hear about BreatheCon? And so I will tell you, last year was, honestly, we just didn't even know if we could pull this thing off. We did. And so, of course, we never rest. And so this year in 2017, we will be holding another BreatheCon, and we will get the word out in a larger way. But we're also experimenting with what we're calling CF mini-cons, and these are 2 smaller events that are topic-based. Again, this is not our idea. These come from the community. So there will be one about transplantation on May 21st, and it will not interfere with Great Strides, I assure you that. And another one about young adult life transitions that will be held in July. So we will get the word out to chapters and to centers. And also we have little cards if you want at our table during one of the breakouts. The idea of BreatheCon is for us to develop a platform, us, the CF Foundation, to develop this platform that will be available to anyone. So we will look for groups who would like to hold an event, and we will support the technical part of it, but the entire content will come from the community. So not in 2017, this is our 2017 plan, but our hope is, as the years go on, this platform will be available to any group of individuals who want to share experiences and support each other. The next, thank you. So the next program I want to tell you about is a peer-to-peer mentoring pilot. And again, this was an idea that came from the community to use the wisdom and the talent of people in the community to support each other in what can be a disease that makes people feel very isolated, and where sharing that wisdom can really help have one person help another. So we did look at mentoring programs in other organizations. Mentoring programs can facilitate sharing experiences of living with chronic illness in a range of chronic illnesses. So Bruce taught us through quality improvement to steal shamelessly, and that's what we did. So in association with our CF Adult Advisory Council, this is a picture of the 2016 Adult Advisory Council, a group of 12 adults who report to the board. We developed this mentoring program in order to provide an accessible, sustainable mentoring program to meet the needs of the CF community and also to meet the metrics that we set. So this is what we do. Mentors come from all over the country, but we started with a pilot group of 12 adult programs. The mentors need to go through some specific training, and that training is you're not a mental health professional, you're not a buddy. It also trains people about the difference between empathy and sympathy, about how to have conversations that are productive, also what to do in case of if there's something that goes beyond that mentoring approach. We do mentor peer matching based on specific topics. And what we did learn in our pilot is that for the people who are seeking mentoring, those peers, we sought them out through social media. So through care centers, but also through social media. And at the foundation, we have a central coordinator who creates those matches and makes sure that it's a personal thing. But once a match is made, we don't get involved. The top 5 topics, so we've done some metrics on our pilot, are managing daily health, work decisions, deciding to have a family, parenting, and dating and relationships. But you can see there's a wide range of things that went on in this pilot program. And I'm not going to read through all of these bubbles, but again, we have just gotten some wonderful feedback. We've also learned some things in our pilot that we need to improve. And our goal for 2017 is we will have a rollout of this program, and by the end of 2017, mentoring will be available to any adult in this country who would like to be involved in a mentoring relationship. And that is our pledge, our plan, and I know we will achieve that. I want to say one last thing about mentoring, and it kind of goes to some themes that have been here throughout the day, which is when you help others, you help yourself as well, and we really learned that through the pilot. So the last thing I want to talk about is the launch of this new initiative. So we've had something called CF Adult and Family Advisors. Everyone in this room has great passion. I want to do a shout out to Christina Roman, Danielle Lowe Cipriani, and Kelsey Fredkin, who I think are sitting in that corner. Please stand up. The Adult and Family Advisors was a passion project of theirs. What they saw was that there were different ways that we were involving the community, but if we really wanted to get this in the CF Foundation in a deep way, we needed to make it easy. So they began the Adult and Family Advisors, but as of today, that name is gone, and we are now Community Voice. This is a name that came from our community, and I'm going to tell you a little bit about what Community Voice is. So Community Voice is a listening arm of the CF Foundation. So it is based on what was the Adult and Family Advisors, no longer exists, and those members came from all over the country. And these are the types of things that people in the Adult and Family Advisors, now officially Community Voice, did in 2016. So when we have surveys that we want to send out, we want to get opinions from a wide variety of people. 12 different surveys were fielded in 2016. When we get people on committees, when we're looking for committee members, we don't want to go back to the same people over and over again. We want to be able to draw from a larger group. So 6 committees were, we drew people from the Adult and Family Advisors for 6 committees. We had 4 focus group projects, and many members of this group helped us design and participated in BreatheCon. So we ask you to join Community Voice, this opportunity that will give you a chance to have an active say in all of the CF Foundation's initiatives, and that will drive improvements and benefit everyone impacted by CF. The thing about Community Voice is you can choose how much you want to participate and when you want to participate. We may send you all of these opportunities, but let's say it's a time when your family's really busy. You don't have to do any of these things, but there may be a moment where you really want to get involved, let's say in something that's 5 or 10 minutes, a survey. Or maybe you really are at a moment where you have a desire to do something a little bit more time intensive, perhaps a focus group, or even something more time intensive, such as a committee or a working group. So who should join Community Voice? Everyone. People with CF, siblings, parents, spouses, anyone who's living with CF. So why join Community Voice? Again, you can take an active role in shaping resources for our community, provide impact on the topics that mean most to you. So some people, and to many of the people in this room, fundraising is a driver, but that's not true for everyone. And so this is an opportunity to provide impact on input on other topics. Share unique experiences, learn and influence initiatives that go on at the foundation, and know that you really can make a difference. So many of these programs that we've talked about are greatly enriched by the talents and wisdom of the community, or maybe there are ideas like BreatheCon or mentoring that we haven't even thought about. So Community Voice is part of Teammates. You can see that the first couple of icons there are about getting involved in events that are run through chapters. The next one is about being an advocate, but the last is about being a part of Community Voice, a different way to be a part of this team and make adding tomorrows easier and incorporate living today in a different way. And some people choose to do all 3. So join Community Voice. We urge you to do so, and also encourage others. The more people who participate in Community Voice, the better the foundation will be able to serve all members of the community, and we are looking for diversity. Your voice deserves to be heard, and we want to hear it. So Community Voice is at cff.org. Community Voice. We've done a lot of work to make it easy to sign up and be involved in the types of things that really speak to you or the people you know who might want to be a part of this. If you're chapter staff, you're going to be receiving boxes of stuff and swag and ways to go out there into the community and make this easier to do, and care centers will be receiving that as well. So with that, I want to conclude. I hope we have a little bit of time for questions. And I want to thank my co-speakers here, and we want to listen to your voice. So let's get to the questions. Thank you.
So it looks like we have a little bit of time for questions, and we do have some good ones coming in. So actually, Drusi, I'm going to kick it off to you first, because this was asked 4 times. Have you considered mentoring programs for younger CF patients and teens, or the families of younger kids with CF?
Of course. And so you have to walk before you can run. So our pilot was, can we make this program work? I will tell you, what we're in the midst of right now is, can we efficiently spread this out for the entire country? And we have some great ideas and some ways that we're going to do that, and we absolutely will make that happen. We started with adults because we heard of this great need in the adult community. Also, there are some issues in that mentoring dyad that were easier for us to deal with when it's adult to adult. I think it's likely that in 2018 we will extend this to parents. But clearly, one of the things that we want to do is to have some support for teens as well, even younger kids. We have heard that very strongly. We will get there. We do need to walk before we can run, but I promise you, we hear that need for connection in this community and that ability to share that wisdom of what it's like to live with CF day after day after day after day, after day, after day, and that has to come from all of you.
Bruce, this is a question about, is the CF Learning Exchange currently available for use? And maybe talk a little bit about the timeline in general.
Yeah, that Learning Exchange is part of that pilot learning network that I talked a little bit about. And it's only open to those, I think it's 13 or 14 CF programs participating right now. So, it's like a lot of the things that we do, rather than put it through the whole network, we'll pilot it, test it, go back and see, does this particular platform work? This was a sort of a homebrew application that was developed at Cincinnati Children's. They're thinking about the next version of that. So we'll be assessing it and see if it's something that we want to spread through the whole care center network. Right now it's just contained within that pilot.
Drusi, can the chapters receive a list of who is already on the Community Voice so we don't keep asking the same people?
Mary, how come you keep asking questions of me and Bruce?
I'll get one. I'm going to get one. I'm trying to be benevolent here.
Yes, we absolutely will. So we have, I think as of yesterday, 350 members of Community Voice, and our goal is to expand that. And so we will let you know at the chapters who is already a member of Community Voice at your chapter, and that'll make it easier not to double ask. And that's one of our goals also, is to make sure that we don't bug people. We want to expand the pie.
Drusi, one reason I keep asking you is because the question for me is, are there trends in the healthcare system that you think might become challenging for the CF community?
Hey, Mary, are there trends in the healthcare community?
So, certainly, I think, we have the best story in medicine, but we also have a story of incredibly complex care and incredibly expensive care. And that's really at the tip of the spear of the debate over healthcare. How much does it cost? Is that sustainable? So I will say, I know I've talked to a lot of you over the course of the conference. Right now, I think we are very squarely in a defensive posture politically, policy-wise. We want to make sure, first, do no harm, right? That's our job right now in the political landscape. But always, this foundation, I think at its heart, drives towards improvement. And we know we have a seat at the table and an important role to play in the issues of how the healthcare landscape plays out overall, and we have an amazing story to tell. So if we had gone back, where I think just about everyone in the country thought we would be in November, we very much thought we'd be rolling up our sleeves and improving on the Affordable Care Act and making it better and really integrating into a healthcare system that is changing and requires some change. And so we are certainly not taking our eye off the ball of where we can be proactive, where we can inject some good solutions. And quite honestly, this sort of tees into the other question that I have here for me, which is really also for Bruce, are the registry and evidence-based talking points about healthcare available for patients and families. To me, that's really where we want to be driving, what the kinds of improvements that we want to see. It's telling the CF story. It's telling the story of the guidelines and the registry and things like STOP too, that Bruce talked about and Mike talked about and Preston talked about. The notion of, are we paying for what matters? Are we paying for what works? That's where we want to be driving towards, and we will absolutely be looking for every avenue to inject that conversation in. I don't know if you want to add anything, because we've had some interesting conversations over the last couple of years with a lot of senior payers who are looking at our model.
Well, what we've found, Mary, as you know, is that the payers are really interested in our story, and they see us as unique because we have data and we have an organized care model, and they're thinking differently than us. I mean, we're thinking about quality; they're often thinking about cost, and we want to make sure the patient voice doesn't get lost in that equation. But we have to understand that we don't want to, back to this STOP example. If we don't need 14 days and we can get by with 10 for the same outcomes, that's good all around. It's good for patients and families. It's good for the payers. Obviously, it saves money. So it's this concept of value that you've taught me about, and I think it's important that we pay attention to it. And we're in a position with the registry data to, I think, do some good things there.
Bruce, here's another one for you. We've experienced a big difference in our adult care centers in 2 different locations. Can you talk a little bit about the standardization efforts around care centers in the U.S.?
That's a good question. If you know one adult program, you know one adult program. It's like that for pediatric programs as well. They each have a unique leader, a unique culture embedded within a unique institution. We do our best to standardize and provide peer oversight to make sure they're meeting the minimum standards and hopefully ratcheting up from there. We've worked hard on the adult care model over the last 10 or 20 years, and I think we've closed the quality gap there for the most part. But we still have a few hot spots where adult care lags behind, and we struggle finding credible and competent adult care providers. And I'm just being honest with you. We're working hard on that to really completely close the gap and build out on the adult care side. So I'm not surprised by that question. And this is back to some of the comments I made earlier. I hope you obviously have the choice. You can go elsewhere for your care, but if you think it's worth your time and effort to engage and try to help them improve, if there's a deficiency that you can help them correct, I think hopefully they will step up and take advantage of your wisdom.
I'll give you a softball. Bruce, where can I find a copy of the patient registry?
All the patient registry data is on our website. It's a little hard to find. I need to talk to Amy about this. If you look under research and you go to registry, it's there. But if you use our search tool, it's kind of buried in there. I usually go to Dr. Google when I'm looking for it, and I put in 2015 patient registry, and it comes up on the first page, and that's how I find it. And it's the entire PDF. It's like 80 pages long. Unless you're a nerd, it's more than you ever want to get into. I love it, but there's a summary table there and a table of contents. You can sort of hone in on what you want to get more information about.
The last question is for me. I've been told last question. How can you discuss how large a role Medicaid decisions at the state level will impact people with cystic fibrosis and how the national office is involved in those? I can give you the 50-second answer and tell you to please tune into the Access and Coverage and Compass breakout. There'll be 2 of them, so you can learn more about it in those sessions. Absolutely, Medicaid decisions are critical, and we watch them extremely closely. This is one reason Bruce and I are attached at the hip. Our team in the policy shop watches the coverage landscape. We rely intently on care centers and families and patients to tell us when there are coverage issues, no matter who the payer is, Medicaid or otherwise, that doesn't jive with good CF care. And we engage in, have conversations using things like the patient registry and the evidence-based guidelines. And often, I want to give a huge shout out to the care centers. Almost every time that we're engaging with a payer, your clinicians are the ones carrying that message for us. We work extremely closely with care center directors in particular. They are testifying on your behalf in front of state Medicaid commissions and Medicaid directors. And so there's a lot of work that goes into that, and we'd love to tell you a little bit more about it in the breakouts. So I think we are 20 seconds out of time, and I think it's time to turn it over to our fearless leaders, to Ginger. Thank you all.
This is my fight song. Take back my life song. Prove I'm alright song. My power's turned off.
Okay, so first I just want to say, Bruce, nerds are cool. Nerds are really, really cool. We're so grateful. That was an amazing panel, seeing BreatheCon. I mean, could you be more inspired? I just want to know where my invitation is. That looks so amazing. I can't wait for King to go to BreatheCon one day. So, to everyone on live stream that helped to plan that, y'all are just rock stars. So awesome. So thank you so much to Bruce and Mary and Drusy. We're now going to have about a 20-minute break. Our breakout sessions start at 10:45, so be sure to go to those. So it's the CF Teammate Giving Your Time, Talent, and Treasure breakout sessions. There are 4 of them to choose from. I think they're up here on the screens if you want to look at the rooms. And then in your guidebooks, there's a little bit more information about them, some descriptions. And then for those of you that are joining us remotely, we want to remind you that all of the sessions are live streamed. And for everyone that is attending the conference as well, no matter which session you pick, you can always watch it later too. So that's one awesome thing. So be sure to get to those sessions by 10:45. Thanks.
I believe,